My main influence in going into medicine primarily was my father. I saw his dedication as a physician, but really more so, I think was his personality and how he treated the patients. I see what I learned from my father in interacting with patients and people and family members. We extend that into our practice by really spending time with the patient, listening to the patient, and really understanding what their goals and what their desires are. And I think the number one problem between a doctor and a patient sometimes is that as physicians, we don't listen, and we already have in our minds the answer before really letting the patient tell us what truly bothers them. And especially in cosmetic practice, you really need to understand what it is the patient wants, not what I want. My job is to really facilitate what they want. And how I do that is really paying attention and listening. I grew up in the Midwest, and I went to school at Vanderbilt University. Then I went back to Missouri and attended medical school there. And from there, that's when I decided that surgery, in particular cosmetic surgery, was really going to be my calling. And I completed my residency training at Yale University in Connecticut, and then went on to California to pursue more of a cosmetic specialty in the head and neck. What used to be something that was only for the rich and famous, so to speak, is very mainstream now. That the everyday person who desires something, it's now available. And that's something that I wanted to give, not just the special population, but to just anybody that really desires some sort of improvement to make them feel good about themselves. A patient comes back to me after attending a reunion or a family function, and they tell me, you know, Dr. Latorre, my friends and family said I looked fabulous. And not one of them suggested that I had some sort of cosmetic procedure. And that makes me feel good, because I know that I've listened to the patient and I've given them a natural look that's really made them more confident. They feel better about themselves because they look natural, as if they just went to the spa and had a nice treatment. And to me, that's the greatest reward in my practice. You know, during the consultation process, I have an opportunity to develop a great rapport and relationship with the patient. That patient may interview other surgeons, and I encourage that. Facial plastic surgery is an important decision and a commitment. We have 95% of those patients come back to us, and the feedback we receive is that they feel comfortable with us, they trust that we will take care of them from start to finish, and that's what separates Latorre Plastic Surgery from everybody else.